Hello, my name is Robert Brill. I'm a fibromyalgia advocate and doctoral candidate in health psychology, and this is my fibromyalgia podcast series. Today I'd like to discuss antidepressants for use with fibromyalgia. Antidepressants are thought to be the most useful of medications in fibro, typically in lower doses than you may see otherwise, for example with depression. While depression is no more prevalent in fibro than in any other chronic illness, it is still quite commonly seen in fibro. These drugs are said to work either way because they elevate the levels of serotonin and norepinephrine in the brain that are separate from depression and function on pain and fatigue. Higher levels of these chemicals are known to reduce pain in fibro sufferers. Tricyclic antidepressants have been suggested to provide some relief for fibro symptoms in the form of restorative sleep, muscle relaxation, and decreased pain. You'll likely receive a lower dose than those used to treat depression alone again. Some examples of tricyclic antidepressants are amitriptyline, Elavil, cyclobenzaprine, Flexeril, doxepin, and nortriptyline. Both amitriptyline and cyclobenzaprine have been proven effective in treating fibro. Selective serotonin reuptake inhibitors, or SSRIs, are typically the next step after tricyclics don't work for you. These too are prescribed in lower doses than versus individuals who are being treated specifically for depression. These promote the release of serotonin, therefore reducing fatigue and other fibro symptoms, especially pain. SSRIs may include Prozac, Paxil, Zoloft, Celexa, or Lexapro. Adding one of these drugs with a tricyclic antidepressant can work as combination therapy. The next type of antidepressant is SNRIs, or mixed reuptake inhibitors. They're newer to the realm of fibrotherapy and have been capable of raising both the levels of serotonin and norepinephrine. These drugs include Effexor, Cymbalta, and Savella, among others. These combination drugs are a bit more effective on pain versus an SSRI alone or a tricyclic alone, and they're noted for their ability to raise norepinephrine, which likely contributes to a greater role in pain resistance than serotonin alone. The next antidepressants are benzodiazepines, like clonazepam or Valium, and they can be helpful for some neurologic-like symptoms associated with fibro. For example, restless leg syndrome and periodic leg movement disorders are really neurological disorders, but it's something that us fibro sufferers experience along the way. These drugs help to stabilize the nerve pathways from the brain that may become erratic, as well as tense and painful muscles, which add to the already poor sleep patterns. These drugs are thought to be highly addictive, though. So antidepressants aren't just for depression and may treat many pain disorders. So consider talking to your physician about them. Thank you.